Thank you very much. So as Will said, this is a pretty novel area, and it's a sort of therapy that I guess has been in the media. As Will said, Tessa Jow famously had this therapy on when she was delivering her address to the House of Commons. It is something that's still just really coming in, and it's not something that unfortunately is available yet on the NHS in the UK. And there are difficulties and problems with it, and I'll talk about those to try and give a sort of a fair overview of the treatment. But I'll also talk about some of the other approaches that are in development that may be either more efficacious or safer and kinder ways of delivering this sort of treatment. I'll also like to talk a bit about the electrical therapy to the brain in more general, to give you a sort of background of where we are, and that this is electrical therapies to the brain are actually a relatively well developed field and have been used successfully for other conditions other than brain tumours by neurosurgeons for some time. As I think it's an area that maybe sounds a bit science fiction-y, a bit sort of quackery in many ways, but there is a solid evidence base and a solid clinical base for the use of electrical modulation of the brain for many disorders, and hopefully this works building on that and bringing the benefits of those developments to brain tumour patients and their families. So there's three sort of main areas, or three main ways, I guess, of delivering electrical fields that are probably relevant to brain tumours. The first one, Optune or Novacure therapy, is probably the most famous in terms of this is the one that's actually made it into clinical trials and into patients. And I'll talk a bit more detail about that. Irreversible electroporation, I'm not going to talk very much about, but essentially that's a very, very high voltage delivered through a probe, and has been used on occasion for sort of very focal tumours. So in adults it's been used for brain metastases, secondary tumours that have spread from elsewhere in the body into the brain as a way of sort of literally just burning those tumours away. I think it's perhaps largely been superseded by developments in radiotherapy, where a very similar effect can be obtained through delivering local single-dose high-fraction radiotherapy, which we would call radiosurgery, and it achieves a very similar thing to that. And I said it's very high voltage and just literally works by electrically destroying tumour material. And deep brain stimulation, which has been used very commonly in other disorders, and one of my particular research interests is in whether we can apply that sort of technology to brain tumours. So the brain is an electrical organ. I mean, all our cells in our body actually are electrical organs. They all rely on electrical currents to function anywhere in the body. But the nervous system, communications, thoughts, actions, control of any organ in the body is achieved by the nervous system through electrical currents. And the millions or billions of tiny connections, the synapses and the neurons between them. So it's been appreciated that electricity can have a function on the nervous system for some time. Initially in very crude ways, in that epileptic seizures can be induced by certain chemicals such as camphor. And really from sort of late medieval times onwards, people tried to use that for various conditions, often psychiatric disorders, with I think very limited success. In the 18th and 19th centuries, there was a sort of vogue for something called galvanism, which again was sort of applying electrical currents to various parts of the body and the head, and trying to stimulate effects through that. And again, I think this was, probably of limited effect. And I think the sort of hangover from those sorts of approaches is often why people are maybe a bit sceptical about whether these sorts of treatments can work. One treatment that perhaps has a slightly darker image is electroconvulsive therapy, and again has been used for some time, and obviously has unfortunately a very poor public image from films such as One Flew Over the Cuckoo's Nest, and perhaps its overuse or the abuse of the treatment in the 50s and 60s and 70s. However, it is applying strong electrical currents to people who are severely depressed with drug-resistant depression at high risk of suicide can be a life-saving measure. and it is still used actually on thousands of people each year in this country, with actually often very good results. And as I say, it can be a life-saving treatment for people with very, very severe refractory depression. So moving on, the next sort of electrical treatment that really came onto the market, and which again probably starting to have more relevance to patients with brain tumours, is vagal nerve stimulation. And this is a bit like the sort of cardiac pacemakers that people have. You have a battery implanted in the chest wall, and then a wire running up into the neck, wrapped around the vagus nerve, which is one of the main nerves that runs from the brain down to the heart and to the bowels. But this relies on stimulating the vagus nerve electrically, and sort of conducting electrical signals, if you like, the wrong way back up the nerve into the brain, and using that to modulate brain function. Now, it's primarily used as a treatment for seizures, for epilepsy, and for reasons we I have to confess we don't fully understand. By stimulating the electrical nerve, again, in people with drug-resistant or refractory epilepsy, you can reduce the number of seizures that they suffer. And it's very effective. It's a proven treatment funded by the NHS, and we regularly put these in for children, adults, young people who have drug-resistant epilepsy. There are some hints that it may even be potentially a treatment for tumours, and there are starting to be studies examining the effect of vagal nerve stimulation on whether that could be used as a sort of anti-tumour measure. The other therapy that came along in the sort of 90s was deep brain stimulation. And again, you have a sort of pacemaker type box in the chest, a wire running up, and Steve Gill was one of the Professor Walker works with, was one of the first people to use these sorts of treatments in the UK. And a bit like, rather than running a catheter into the brain, you run an electrical wire, and that is targeted to particular areas of the brain that are known to be important in particular diseases, particularly Parkinson's disease. And again, it's a proven, evidence-based treatment for Parkinson's disease. There's a video. The next slide is a video of someone with Parkinson's disease who has a deep brain stimulator in. There's no blood or gore, but it is a patient from America. If that works. So he's from Louisiana, so that's why we don't speak with this accent normally.
Bilateral stimulators, and we're here for the initial programming session. This is what it looks like without the medicine and the stimulator. Now we're just going to turn it on.
So that's the programmer. The sort of black thing lying on his chest is just a programmer that's just sat on the clothes. It's just for the programming session.
See how that feels.
So the current coming on there. They turn the stimulator on. You see it abolishes the tremor.
Yeah. Try tapping both your fingers for me. Excellent. All right. Feels pretty good? Very good.
So it can be very effective for those, and it's, as I say, it's a very well recognised treatment now for Parkinson's disease, and its use is being expanded into a lot of other conditions, dystonia, even some mood disorders, even things like anorexia. People are trialling, stimulating different areas of the brain to have, beneficial effects in those conditions. It reduces, a broad range of symptoms in that condition in patients. So that neurosurgeons have quite a lot of experience of putting these in. So one in Nottingham, we've put a couple of hundred of these in now. And the electrical therapy for the brain has now moved on to examine tumours, and really the major thrust of that has been through the Novacure company and the Optune device, and this is what it looks like. So in patients, it's licensed for patients with high-grade brain tumours, particularly glioblastoma, and it works essentially with an array of electrodes on the patient's head that are arranged in a planned fashion to direct an electrical field specifically to certain areas of the brain around where the tumour was or is, and to deliver an electrical field, to deliver voltage into those areas, and we think, as I'll show, that has anti-tumour effects. Now this is a model posing for the photo. The reality is, this chap, as you can see, he's got a backpack on. That's the battery pack for the electrical wires. You have to carry that around with you. You have to have the it works. Obviously, the more you use it, the better effect it has, and they recommend you wear it for at least 23 hours a day, so it's pretty much all the time. Patients have to have their head shaved daily to allow the electrodes to make contact. Unfortunately, obviously, that's pretty irritating to the skin, and the pictures here are from a paper where they were showing, people getting rashes and dermatitis in the skin, and there is a substantial commitment, I think, on the behalf of the patient to wear this and to use the device. So we think it works essentially by when a cell divides, all the chromosomes line up in the middle, and they're quite big molecules, and every molecule has an electrical charge. And it's thought that Optune works by disrupting the sort of coming together of the chromosomes when cells divide, and essentially causing that to happen in a failure of that process, or interfering with the cells dividing. And by concentrating an electrical field at that point where the two cells are pulling apart, you stop that process from happening and cause death of the cells. Now, the good thing about the brain, obviously, particularly in except in perhaps smaller children, most of the cells in the brain aren't dividing, and the tumour cells certainly, hopefully, are dividing at a much faster rate. And TT fields or Optune has very little effect actually on cells that aren't actually dividing. It doesn't seem to cause too much in the way of side effects. So it has been used in clinical trials in adults with recurrent glioblastoma, where it didn't have a great deal of effect on survival compared to conventional chemotherapy, but had a much better side effect profile. So it seemed to be as good as conventional chemotherapies in this trial. They then did the sort of main trial where they looked at people who were newly diagnosed with glioblastoma, and they did seem to show a benefit in terms of overall survival, perhaps of the order of 3 to 4 months compared to conventional therapy, and significantly increased 2-year survival rates compared to conventional therapies. And this is to show you, so these are patients that were being treated for their glioblastoma with radiotherapy and temozolomide, and either received TT fields or didn't receive TT fields. And both progression-free and overall survival were increased in the group receiving the electrical therapy. Now, you might think that's quite convincing, but it has been met with quite a lot of scepticism from certain sections in the medical and surgical communities. The trial was perhaps not designed to quite the highest standards, and I think that if we're going to disseminate and get public and particularly financial backing from governments and other bodies for the trial, it's really important that any research and any trials are conducted to the very highest standards, so there's no question of it being accepted. The other major issue I should mention with Optune and Novacure is it's phenomenally expensive. It costs £20,000 to £30,000 per month. Now that's largely to do with the fact that you need an engineer to check the position of the electrodes and check that you're getting the current delivered correctly on every few days. So there's a huge labour cost, ongoing labour cost for the company that obviously they have to recoup. And unfortunately, at the moment, the cost is extremely high. Now, I sat on the NICE Guidelines Committee that looked at treatments for primary brain tumours, and although we felt that, on balance, Novacure probably did give a small degree of benefit to patients, it's very difficult to justify committing that amount of NHS funds at that level of pricing. Now, if the cost came down, I think it would be approved and it would be available. But you're essentially paying for a specialist nurse post for one patient for every month that they have the treatment. And sadly, living in a world with a fixed finite pot of money, the committee didn't feel that spending that amount of money was the best use of those sorts of resources. Now, as I say, I think discussions are ongoing between the Department of Health and the company, and if the cost were to be reduced, then I think adoption could happen probably fairly quickly onto the NHS, but it would need a substantial movement in terms of pricing. So just to talk about some of our in-house research very quickly, as I mentioned, deep brain stimulation we also feel could be a potential, and it overcomes some of the difficulties with Optune. It's all internalised with deep brain stimulation, so once the device is implanted during an operation, it's all internalised. You don't have to carry around a big backpack of batteries. You don't have to have your head shaved every day. And once it's implanted as well, we know from the large experience we have with Parkinson's patients that you don't need constant checking. You have it checked externally with a sort of pacemaker type check every couple of months, every few months, which can be done quite quickly in a clinic setting. And certainly, although the capital cost of putting the wires in is perhaps about £20,000, actually the ongoing costs would be significantly less, and you wouldn't need this huge labour cost of constant checking of the electrodes. So we've been checking the effect of deep brain stimulation on tumour cells, and we found both in adult and paediatric glioblastoma cells that, again, by delivering an electrical field through a deep brain stimulator electrode, you can get a reduction in cancer cell viability, which is fantastic. Here we see different voltages delivered through DBS electrodes. You can see as we increase the voltage, we reduce the number of cancer cells that are available. And we've been comparing this with the in vitro system, the Optune system, again, the company haven't yet tested Optune in childhood brain tumours, but we've shown that certainly in the laboratory, by delivering those sorts of voltages to childhood brain tumours such as glioblastoma, but also medulloblastoma and ependymoma, we can achieve a reduction in cancer cell viability and biological effects on the cancer cells that are promising, and potentially suggest that electrical therapies could be used in childhood brain tumours. And excitingly, we get additive effect when we combine those with chemotherapeutic agents. So a possible strategy could be to enhance the effect of existing or new chemotherapeutic agents through administration of electrical fields, either through the existing Optune system or through a more novel